Hi, my name is Dr. Raja Adnan Ahmed, and I'm a psychiatrist and I work in UK. This video is part of my NHS job interview series on YouTube, which I'm making specifically for the international medical graduates. And I'm discussing some of the common questions which you may encounter in an NHS job interview. So remember, I'm not trying to give you any model answers. All I'm trying to do is trying to explain what are the common questions which you may encounter and how can you approach them, the concepts behind these questions, and what is the panel trying to ask you. You have to come up with your own answer. Every individual doctor has their own set of skills. They have their own CV. They have their own personality. So it will all your answer will all be a combined combination of all these three things. So let us start this video and let us tackle one of the common questions which you may encounter in an NHS job interview. So one question you may get in an interview is about your style of leadership. This could be asked in different ways. They may ask you that what is your understanding of a healthcare leader? What is your style of leadership? And what are the skills of a good leader? And how does those skills apply to you? So remember, this question could be asked in different ways, and especially if you're going for a middle grade job or a higher grade job like a locum consultant or a consultant job. So the reason they're asking you for your style of leadership is that because when you're going for certain job in NHS, they're not just looking for people who can manage the medical side of the work, but they're also looking for somebody who can actually lead a team, who can make some changes, who can help them to improve the service. So let us tackle the first part of this question, that what is medical leadership and how does it apply to doctors, and what are the qualities of a good leader in that sense. So medical leadership, as I already said, that it's about doctors taking responsibility of the team, taking responsibility of the service, taking responsibility of the patient care. It's about trying to improve the service. It is about looking at how the patient experience or the team's motivation or the team's workload, how that could be improved. When we are working as a doctor, either it could be in a hospital or in a primary care setting, it's very rare that we are working in isolation. We are almost always part of MDT, which means that we are working with other colleagues, which may include junior doctors, the more senior doctors, the nursing staff, the other occupational therapists, psychologists, and other staff. So in that sense, medical leadership is about understanding your team, understanding their team strengths, understanding that what are the needs for the team and service, and then trying to make some changes that can improve the service. So if asked to describe the qualities of a good leader, there are certain qualities you can mention or certain qualities which you can talk about. For example, a person who's a good medical leader, you will notice that they will have a vision, and they have the ability to motivate their team members. They will have the ability to understand their team, they understand the skill set within the team. They have understanding of the strengths and weaknesses of their team members, and they have the ability to mentor their team. They have the ability to actually understand the issues that are coming from the team dynamics, and then try to work with that team to get the best possible outcomes. But also remember, anybody can list the qualities. That might not make a very good interview. When this question is asked to you, they may ask in a way that what is the qualities of a good leader and how does it relate to you? Even if they're not asking the second part, that how does it relate to you, I think it's the best way to answer this question would be to actually pick up those qualities and apply it on yourself, apply it on an example which you can give the panel. That will be a more impressive answer. So as a junior doctor, what could be the examples you can give? So if, for example, as in your medical school, if you were a part of a society where you were having a leadership role, that will be a good example to give. For example, if you were working as a house officer and was involved in a project or involved in an activity that was leading to improving the patient care, this is something you can use as an example. Let's say, for example, an example which was given to me recently by a junior doctor, that while they were working as a house officer, they were made the responsible person for the rota. And then when they became the responsible person for the rota, they started to realize that certain junior doctors, certain house officer were not happy with the way the rota was run, and they were thinking that maybe they were given more hours than other house officer. So what they did was they actually got all of the house officer as a team, and they get them in a meeting. They started to ask them what are the issues in this rota. What are the things you are struggling with? How can we improve this? So it was not just about the working hours. It was other issues like handover. It was other issues like conducting the ward round, conducting the other clinical duties on the ward. So they were able to identifies those issues, and with the team of junior doctor, with the team of house officer, they were able to make some changes. Now this is a good example to give, that when you are given a responsibility, you were able to understand your team, you are able to understand the issues, you were able to actually come up with a plan and then implement that plan that lead to improvement of the quality of the service, not just the quality of the service, but also the experience the junior doctors or the house officer were getting from the service. Now, another way this question is asked is about your leadership style. So they may ask you that what is the leadership style you generally have? What are the different style to lead, and which one of these styles applies to you? Again, you can go on internet and find different styles to lead and the examples, and to see how they are different from each other. But when they're trying to ask you what is your style, I think it's better to understand some of these styles and relate to an example and give that to the panel. So for example, if this question is asked from me, when this particular question was asked from me in an interview, that what is your style to lead, which style are you using? So I give them an example of two different styles. I said to them that I actually don't have a fixed style, and my style to lead will depend on the team I'm working with. So for example, if I'm working in the community, when I have a very experienced, highly skilled, multidisciplinary team working with me, MDT, which has senior nurses working with me, psychologists, occupational therapists. In those circumstances, my style of to lead is more democratic, which means that I like to gather feedback, gather opinions of all my team members, and I want them to feel like they're part of the team and they're actively contributing. And then it's not just that I am trying to impose my own my own judgment on them, but actually I want them to work as a team and come up with the solution which we can all own up to. So another style to leadership is autocratic, and in this particular style to lead, the person who is in a position of power is actually more assertive, and this type of leadership style can be applied to, for example, if you're on call or if you're dealing with emergencies. So if you are dealing with emergencies when a quick judgment is required, you may not have the luxury to consult up with a lot of people. You may not have luxury to consult with an MDT. And the people who are asking for advice may not be that experienced. In that, they are probably looking for a more assertive answer that they can take forward. So, for example, if you're doing an on-call, dealing with an emergency in a hospital situation, that your style to lead may become more assertive. So, in summary, if you're going for an NHS job interview, especially if you're going for a more middle grade or a higher grade level job, even if as a junior doctor level job as well, be ready for this question. They might ask you about the importance of medical leadership, what are the different styles of to lead, and what are the qualities of a good medical leader. So read about these things, apply them to a practical example that you can use, you can give to the panel. And by doing that, I think you should be able to tackle this question very well and should be able to impress the panel. So thank you very much for listening to me, and hope this video was useful. And I hope to see you again in another video with another interview question. Thank you.